Hello, I'm Dr. Harold Bafitis. I am board certified in plastic surgery and in general surgery, and I've been around for just about 33 years. One of my areas that I like to explore with my patients is regenerative medicine, and I happen to be the medical director of Illuminaire. And I would say that regenerative medicine is the frontier of what's going to happen in medicine in the next 5 years. I believe that it will become one of the leading edges of medical care, and I only think it's a matter of time. In relation to my experience with allografts in general with my patients, it's been extensive over the last 5 years with improvement in injured areas, joint pain, knee pain, neck pain, people that have had multiple back surgeries that wanted a non-surgical alternative. We've used these allografts as injections, and honestly, I could say there's never been one patient that has not had some degree of improvement. What I qualify as improvement in terms of the anti-inflammatory effects of these allografts, which modulate pain. I can't say that all of them have gone from a 9, 10 being the worst pain down to a 0 or 1, but we've had people that have had at least a 9 down to a 5, a 9 down to a 6, with a modicum of good improvement. We've also had some incredible results where they've been in pain for 20 years and all of a sudden their pain is so manageable that they have a whole new life. I also have experience being a patient. As a surgeon, I've had severe neck spasm because I'm taller and I kind of use my neck forward with a headlight with all the reconstructive and cosmetic procedures. So it's been a chronic issue for me. I've developed a bending of the curvature of my spine called a kyphosis, and after long procedures, some of them being 5 or 6 hours, sometimes longer, I have some severe neck pain. So besides lymphatic massage and traction, I've also had the allograft injections into the areas of spasm. And it's been about 4 months now, and I could truthfully say that the area that used to be so painful after surgery is essentially down to a level 1, where it was level 8 after surgery. Other areas are getting further down, are involved, but the neck, which was keeping me awake, is down to a level 1, which to me is a tremendous improvement. And if anybody was nebulous of the result, it would be me, because I'm a scientist and I waited to see, and so I think that is proof. Also, being a patient, I think, makes me a better practitioner because I could relate to my own experience. One of the things that we're seeing is the regenerative medicine space is enlarging and growing to the point where we have people that are, well-known life coaches. For example, we have, Tony Robbins writing an entire book on regenerative medicine, and we're seeing people open up centers all over. And as I said, this will be the forefront of medicine in the future. Because imagine having inflammation resolved without all these drugs and their side effects. That in itself is a miracle. And what Illuminaire offers, more than, I would say, other centers that I've heard of and had patients tell me, is a scientific approach. We follow the patients, we treat them as if every treatment is a sterile surgical treatment, and we follow them at 1 week, 2 weeks, 1 month, month after month, till we get a reading as to how long it takes for them to feel an improvement. And so this data of science will help propel this field further. And I believe that is something that we need to make sure that this is quantified and it's passed on to other practitioners, because I believe this will be a field that will be wide open to so many different specialties. And Illuminaire offers that ability, the science-based, the fact that we could report this and provide evidence-based medicine instead of subjective, anecdotal stories that people tell. We're backing it up with science. And we use the very best products, and the products have been detailed as to what's in them and how they're prepared and how they're procured. So I wouldn't be affiliated with some other group that hasn't had this type of level of indulgence in terms of the scientific modality. We're like where antibiotics were in the beginning of the century. So I think this is great, and I'm happy to be part of it. I say to the skeptics, to my fellow colleagues, to all healthcare workers, when you look at allografts and you look at the growth factors that are in these allografts and you look at the fact that inflammation is controlled so much better by our own bodies than chemicals, you can't be a skeptic when you look at the hard data. Usually when we treat inflammation, we're creating worse problems with cortisone and all these anti-inflammatory drugs that you see on TV for psoriasis and all these disorders. We're actually harvesting the ability of your own body to heal itself. And again, this may be a skeptical, paradigm, but no, it is hard science, because we're using allografts that have anti-inflammatory cytokines. It is something that I believe over time, even the skeptics will come to say that the proof is in the pudding, the proof is in our patients, and for the skeptics, come on board and see what's in store.